Dr. Nuaki, there have been many medical, let's just talk medical, let's not talk about not eating, because we obviously know that, and that would probably be a good thing, or at least not eating so much. But the truth of the matter is, many of us in many areas don't have the discipline to go there because it's painful. Tell a smoker to stop smoking or a coffee drinker to stop. He gets sick, he gets headaches, he gets all kinds of things, and he will go right back into it because the headaches are worse than whatever else he thinks. So there is medical treatments. Tell us about medical treatments which have been and which are, and their workability and how you fit them in it. Is there stuff out there which people actually don't know is new, and they're still hanging on to old ways of medical surgery or medical balloons or whatever it may be? Tell us about it.
Yes, there are two spectrum. One is pure medication, and at the other end you have surgery such as gastric bypass. In between, the gastroenterologist can offer several therapies. Some of these include balloons. The balloons are evolving. This is a balloon that can be swallowed and inflated inside the stomach, therefore filling up some space in the stomach and making you feel a bit more full and preventing you from eating too much at a time. The balloons are placed for about 6 months and then removed. And during that time, people are able to lose significant amount of weight. The main aim of the balloon is that during that 6 months, you won't be hungry and you'll be learning how to manage your food intake. Another option that has come about now recently is doing...
Can I go back to the balloon just for a second?
Sure.
Are there any dangers involved? I mean, are there any... surgery is a surgery. I assume, there's always some type of risk. Is it a relative safe thing for most people, or what's the deal on it?
Yeah, the balloon is relatively safe. There are 3 different types, and each one has its own risks. The one that there's some that are extremely safe. However, the biggest risk has been ulcers. The balloons rub inside the belly, and they irritate the lining of the stomach, and that there have been several reports of people getting ulcers with the balloons, and so they have to take medication to prevent that. Most of the people who have developed these ulcers did not follow all the guidelines. The other thing, of course, is if it's in there too long, it can cause some damage to the lining of the stomach. And unfortunately, some people don't want to return and have it removed after 6 months. They want to keep going. And that has also caused some complications. But as a rule, these procedures have been extremely safe.
Okay. You were about to mention 1 or 2 other procedures.
Yes, gastric bypass it works a lot, but what the gastroenterologists have developed is to do this through a scope. So instead of cutting the abdominal wall, cutting on the belly, they go through the mouth with the scope that we use for normal scopes, and then make sutures inside the stomach. So the patient just has sedation as they would have for endoscopic procedure, like a colonoscopy type anesthesia. So it's not as deep anesthesia, and the procedure is not as invasive. It is a relatively very effective measure, and so it's halfway between medicine and surgical gastric bypass.
So what happens to the patient there? He eats less, or what's the...
Yeah, because the balloon, the stomach is sewn so that it forms almost like you may have heard of a surgical gastric sleeve. So that the stomach is narrowed, or a portion of the stomach is cut off by suturing, by sewing it off. And so the stomach becomes much smaller and can accommodate less food. And therefore, people can eat less and get full quicker.
So same effect on the balloon, just no balloon, it's just the actual stomach is sewn off.
The actual stomach is sewn off. So it's a bit more invasive than the balloon. And it can last longer because it's semi-permanent. As long as those sutures stay in place, you have this semi-permanent procedure. So it's much more long-lasting.
Well, all right.
Now, very interesting one, which I really like, but a lot of people are a bit hesitant about, is something called an aspire procedure. And this, you actually put a hole in the stomach coming out to the body wall, and put a device through the hole in the stomach out of the body so that after you eat, you can drain the food out. And it's a very interesting concept, and I think it works well, but it has a little bit of an ick factor. People just don't like the idea of draining out their food.
Just when you talk about it, that ick factor came over.
But it's actually very, I think it's very elegant. And it turns out that people, the big thing about this is to drain your food, you have to chew it very well, because if you have big chunks of food, they will not be able to drain from the stomach. And the theory actually is that people have to chew so long, it makes them take a longer time to eat, and therefore they eat less. I think one big problem is we just wolf down our food way too quickly. So by having to chew so well, people learn to take time eating, and it works very, very well.
So, Dr. Nuako, did you or the medical profession, did you kind of like steal this idea from training the stomach from me when I was young? when I was young and I had too much scotch and I put my finger down so that it all comes out and then I could continue drinking?
It is exactly, and we cannot give it to somebody who does that. It's contraindicated in people who have, there are some people who have an eating disorder where they eat and throw up, bulimics. So if you're bulimic, you're not allowed to get this procedure. So it is in a sense that way, yes.
Okay, well, all right. Thank you very much, Doctor.
Sure.